Let me just clarify that this is not unique to Kenya alone. We have had challenges even in the developed world in terms of reporting of the cases, because sometimes, as Madam Waziri has said, you have to do multiple tests. And unless you are very keen, sometimes you report a repeat test as a next case. Based on that, we went back to our data bank to be able to mine the data further. As at today, the total number of cases stands as 1,745. Total number of persons admitted in 37 hospitals across the country stands at 671. So you minus that from 1745. Total number of discharges is 438, again minus that from the original figure. Total number of deaths, 62, again minus. There are various patients who are in isolation at home, either because of age or because they are breastfeeding mothers with small children, or they are pregnant women who may not be well managed in a health facility and are asymptomatic. This number stands at 130. Remember, we had evacuees from India who had gone for treatment, and based on our risk profiling, we decided that a given number of them could be managed at home with follow-up by our healthcare workers. So again, take away 130. Then there's this critical group of the people who gave us wrong contacts, whom we are chasing. And you remember Waziri yesterday told you clearly that eventually the long arm of the government will catch up with you. That is 140 persons. Minus that again from the other figure. Then we have a group of foreigners and drivers. Remember when we ramped up testing at the border points, including Namanga, Isebania, in the spirit of East African cooperation, our neighboring countries requested that their nationals, instead of being isolated in a foreign country, they be taken back. That number is 30. That leaves you 274. Out of these 274, today you have reported 127 cases. So these cases are in the process of being admitted into the various isolation units. Together with the 147 yesterday, until we update that data in our contact list, line list at the Emergency Operations Center, because you have to get this data from all over the Republic. So if you minus that 274, the figures balance out well. And I believe you have been doing the math as I highlight these figures to you. So that is the position. Further, to be able to avoid this in future, we have refined our template together with our partners to ensure that we are able to capture this information real time as the data is generated from the counties. And then remember now with the community transmission, the battle shifts from the capital city Nairobi, even though we still report more numbers here in Mombasa, but a significant number of counties, now standing at 32, have recorded cases. So as these cases come from the counties, we want to capture that data real time so that our figures continue to add up. Thank you.
One final question for Dr. Amoth, if
Yes,
I can. Dr. tell me this. The president recently hinted at substantively reopening the economy. I want to know from you what medical data would inform this reopening. For example, in New Zealand, we know they began reopening after 3 days of 0 positive cases of COVID-19. On June 6th, Kenyans are waiting to hear from the president. What medical data would determine what decisions he'll make?
One of them is what you have highlighted. The other one is total number of cases and many other variables. But we'll be able to give you a comprehensive report on this on Saturday when the National Emergency Response Committee meets. We have been working with our modeling team, the combined University of Nairobi, Jomo Kenyatta, Strathmore University teams, and they have come up with parameters, and it would be premature for me to share that without the authority of the chair of the National Emergency Response Committee. Thank you.